I just came to get tested and was able to get an appointment.
Delta variant concerns is what made Molly Balfour come into the event center at A&T College to get a COVID-19 test. She plans to travel for the first time in more than a year.
I'm fully vaccinated, but I know that a lot of people aren't, and with the increase in the Delta variant, I think it's better to be safe than sorry.
She's not the only one who's concerned.
You can never really be too safe when it comes to stuff like this, especially with everyone not wanting to wear masks and not wanting to get vaccinated.
As North Carolina works to stop the spread of COVID-19, the state is seeing a renewed increase in COVID-19 testing. According to the North Carolina Department of Health and Human Services website, you can see a dramatic increase in COVID tests from just 1 month ago. In July, there were less than 21,000 tests given. In August, more than 40,000 people went to get tested.
A $100 gift card for a vaccine really has brought a lot of people out, and just this concern of how contagious the Delta variant is has concerned a lot of people. So you combine both of those together, and we saw a lot of wait times yesterday.
David Thompson, Cone Health Assistant Director of Infectious Disease, says because of those hour-long wait times, testing will only be done now by appointment.
We want to be respectful of people's times. We have a set amount of staff, and so we need to be able to staff to the demand.
He says while it's good people are concerned about their COVID-19 status, the best defense against the virus is getting vaccinated.
Some people that are vaccinated, yes, will get COVID. But what we're seeing is people that have been vaccinated are not getting nearly as sick as people that are unvaccinated.